name is Holly Scribner. I'm here to do a quick video talking about asthma. Asthma is a chronic inflammation in the lower airways. It affects many men, women, and children in the U.S. today. Asthma is not curable, but with the right asthma plan, you can live a happy, healthy lifestyle. We're going to talk a little bit about the disease process, the pathophysiology, and how it affects your health. We'll also cover medications and treatment plans, as well as asthma action plans to help prevent episodes and to live the best life you can possibly live. Thank you. Asthma, a quick review and a lesson on the battle that many people fight today. A little on statistics. 1 in 12 people have asthma, and the numbers increase every year. 1 in 2 people with asthma have had an attack in 2008, but many could have been prevented. It costs the U.S. about $56 billion in medical costs, and the number diagnosed with asthma grew by 4.3 million just in 8 years. Asthma was also linked to 3,447 deaths in 2007. Asthma is a lifelong disease that causes wheezing, breathlessness, chest tightness, and coughing. It's triggered by an allergen or irritant that causes the airway inflammation. The airway becomes infiltrated with cells that react to the allergen, mucus production, muscle constriction, and swelling of the tissues, making it difficult to move air into the lungs so that we can become oxygenated. The result of this inflammation is chest tightness, difficulty breathing or shortness of breath, coughing, wheezing, chest pain, or pressure. Symptoms can become emergent very quickly, and they should seek out medical care immediately. Symptoms also vary between people and children and adults and can present different in all age groups. Persons with asthma may be limited on some lifestyle choices, but can learn to take precautions and live with minimal limitations. To live with the fewest interruptions possible, developing an asthma plan with your physician is the best course of action. An asthma plan includes a diary of asthma attacks, monitoring your lung function, identifying triggers, taking medications as prescribed, and education on the early signs and how to manage your asthma. Once identifying the triggers that causes your asthma episodes, the best course of action is to try to avoid these whenever possible. Many triggers can be environmental, like insecticides, cold air, perfume, cooking, paint fumes, but there are non-environmental triggers as well: emotional upset, crying, laughing, exercise. If you know your triggers, you can manage your asthma by preventing and pre-treating when possible. Education is the key to successful management. Knowing your own medication regime and when to alter, when to use a rescue medication, how to prevent treatments, what are your triggers and what you might need to avoid, and how you want to alter your day, and also monitoring lung function with peak meters to know when your lungs are not functioning at 100%. Part of the medication regime for asthma is preventative. There can be a combination of different types of medications. Oral medications like antihistamines or antileukotrienes, inhalers that deliver bronchodilators, as well as injections for bronchodilators. The second part of the medication regime is rescue inhalers and medications. They can be oral or systemic steroids given to decrease inflammation, but something that's going to be used right away is the short-acting bronchodilators or the inhalers and the anticholinergics to open up the airway and get air moving. A lot of times side effects of these are dry mouth, a bad taste in the mouth, but they can be relieved with make sure you're staying well hydrated. Asthma is not ever cured. Most people have to take medication daily for the rest of their lives. Unless a specific trigger, such as exercise, is what induces the asthma, then only pre-treatment may be sufficient. This doesn't happen often. Most people are treated forever. Never stop taking your medication without the approval of your physician, and let your physician know if you're taking any other medications as well. In order to evaluate the effectiveness of your treatment, you need to maintain regular checkups with your physician so that they can measure how your treatment is working. They're going to want you to keep an asthma diary or daily log of attacks or episodes, your lung function tests, your medication regime, known triggers, how you can avoid coming in contact with them, your activity levels, as well as the number of ER visits or hospitalizations you have. Asthma cannot be prevented nor can it be cured, but with the proper management and education, episodes can be controlled and minimized. All patients receiving a diagnosis of asthma and their parents should attend education early in the diagnosis. Patients should have a clear understanding of which inhalers are to be used daily and which to be used when they have an episode. They should also have a clear understanding of what rescue medication is and why. The asthma management plan needs to be updated frequently and followed closely to ensure that you live a long, healthy life. Health promotion for asthma should focus around education. Asthma education, of course, should be a part of every doctor visit for the asthmatic and their parents, but education should also be provided in schools for administration, teachers, and other students so they know how to act in the event of an episode. There are tools for schools, churches, and activity centers that help guide people that are uneducated how to manage an asthma attack, when to call for help. And also, education at health fairs can include asthma in the generalities for the general public. Thank you for joining today as we discussed asthma, and until next time, bye-bye.